Hi, I'm Sam Barrett. I'm a WISE clinician with Seneca, and I've been with Seneca for coming up on a year.
How did you become a part of Seneca?
I learned about Seneca through one of my classmates at my grad school program, and she was an intern here, and she always really amazed us with how well she was treated at Seneca. The way that she spoke about the work culture, the support. And so it made me really curious, and that's how I ended up looking for a job here.
What is the WISE program?
So WISE stands for Wraparound Intensive Services. It is a team-based comprehensive approach for mental health treatment. We are one step down from inpatient. So that means that a lot of our clients have either recently been hospitalized or are at risk for possibly being hospitalized. A WISE team is made up of a clinician, a care coordinator, a youth partner, and a family partner. And the really cool thing about the youth and family partner is that they have to have similar shared lived experiences to have that role. So when they work with the family or the youth, they're able to use their own lived experiences to help guide support.
What does daily life look like as a WISE therapist?
If you ask me that on any other day of the week, it's probably going to be different each day. We really try to meet our clients and families where they're at, reduce barriers. We meet with them in the community. We meet with them at parks. We drive them around. Sometimes I'm in the clinic. Sometimes I work from home if I'm doing paperwork or documentation. Oftentimes I'm probably in my car driving in between meetings or client sessions. I might be at a client's school, I might be at their home. So it really depends.
Who do you work with on a daily basis? And how interconnected is the WISE team?
We are very interconnected, and we have a lot of collaboration, and it is a team-based approach. So, the WISE team works really closely with the family and youth, and we have a meeting each month with everyone on the team. And this can include other professionals working with the youth, teachers, neighbors, family, friends. We try to build off the strengths that are already in the youth and family's life and include a really supportive and comprehensive team for them.
What population does WISE serve?
We serve all different kinds of youth from different backgrounds. And I think that also shows that mental health really affects anyone and everyone. We have, different socioeconomic status with different clients. We have families with different medical needs. We have families of and clients of different gender identities and sexual orientations, as well as age. We work from 5 years old up until 21 years old. My current youngest is 9, and my current oldest is 17. So I definitely see a wide range of youth that I work with.
How does someone enter the WISE program?
So the process starts out with a referral, and just about anyone can make this referral. We've had referrals from siblings, caregivers, social workers, and then after the referral, they're put on our wait list. And then we try to aim for 2 weeks before we would open them to have a phone call and do a short screener. And if they screen into our program, we call and we schedule an intake, and the clinician typically does the intake.
Why is the WISE program so important?
We're here because we're reducing barriers to mental health care. We're also trying to create, keeping kids at home rather than in inpatient care or in a hospital. We really try to do the least restrictive as possible. And it's really important that these families are approached with a family and client centered voice, that we engage the natural supports and the professional supports that are already in place to build off of those strengths. We engage all of the supports that are already in the client's life, which helps to identify and build upon the strengths that already exist within that youth's life.
What is the impact of the work that you do?
The impact of the work that I do is that I'm able to connect with the clients in a very personal and honest way. I'm able to get a glimpse into their life and family dynamics that, typical providers who might just see a client at a clinic or in a hospital may not see. I'm also just drawn to the work in the community. And a reason that I'm in WISE is because I really believe in WISE. I believe that the best way to support a youth and their family is to come at it in a comprehensive, collaborative, youth and family centered approach. I work with a lot of clients and families who have gone through a lot by the time they reach us. They've slipped through the cracks. And I feel really proud to be on WISE and see and connect these families on such a personal level and support them in identifying that they are not just what happened to them, that they have strengths and that they mean something.
What are some of the benefits to working at Seneca?
The first thing that comes to mind are the people. The people who work at Seneca, you know, we really know each other. We really like each other. We really support each other. And it's not just, coming into the office or joining a meeting. It's really checking in personally and professionally and having a team that really supports and wants the best for all of us. I'm personally working towards my licensure as a social worker. So that's been a really great opportunity for me. I get 1.5 hours of individual supervision each week and 2 hours of group supervision per week. So it really helps in working towards my hours. Also, upon licensure, you get a $4,000 increase in salary. And, Seneca really stays on top and competitive with really making sure that the people who work with Seneca are taken care of. And it's really cool to be part of such a supportive and friendly agency. Being a mental health agency, it's not just something that, is said. There's not ridiculously long caseloads. It's really encouraged that staff actually take care of themselves, that they take time off, that they reach out when they want support. I've personally felt very supported by both my program supervisor and my clinical supervisor, whether it's a call to kind of debrief and process, either a crisis that just happened, or even if it's just to be really excited. Like, I just had an amazing session and, I got to witness this client and their family member connect. And I got to be witness of that. It's really great to be a part of an agency that really deeply holds on to their values and really lives into them.
Why should someone work at Seneca?
Someone should work at Seneca if they really want a collaborative, supportive, friendly work culture, if they really want to be a part of something meaningful and be a part of an agency and work with individuals who really believe in, supporting the people that we work with and reducing barriers to mental health and living into our values. If you want to be a part of an agency that doesn't just highlight and advertise talk, that they really align themselves with their values and live into them, it feels really cool to be a part of a team where people have those shared values and that we share joys together. It feels really personal and it feels really supportive. And I feel really lucky to be here.
How can someone apply?
You can go to senecafoa.org. We're always looking for new applicants and to expand our team.